University Health Partners is the faculty practice for the John A. Burns School of Medicine. And most recently, we also added the School of Nursing and also the Cancer Center. Many of our faculty are actively practicing medicine in the community, and that's an essential part of our teaching and training process. Most recently, we changed the name to University Health Partners because we felt it more effectively communicated what we really represent and what we're trying to accomplish. We're really a collection of practices of the various departments and schools at the university. We have practices in geriatrics and surgery and medicine, in obstetrics and gynecology, and psychiatry, and just to name a few. So the practice is a collection of individual department practices that we pull together in partnership in order to create a multidisciplinary, multi-specialty practice.
Well, we have some interesting attributes as a medical school and as a faculty practice plan. For one thing, we are one of the roughly 20% of U.S. medical schools that's known as community-based. That is, we do not have a dedicated university hospital overseen and run by the university. The practice plan sits as a separate but affiliated part of the medical school. It's a separate 501c3, but with heavy involvement of our faculty, department chairs, and other leaders on the board to help make sure there's good alignment. We also, of course, work through that practice plan with the hospitals to try to make sure we advance their needs for optimal medical care in their facilities, again strengthening the clinical learning environment for our students.
We're very pleased with the name that has been selected by our board and with much discussion with our member faculty as the University Health Partners of Hawaii, because it really reflects our strategic initiative, which is to work with providers who have been historically teaching our students and residents in the community and giving them a vehicle to help coordinate their practices with the academic goals that they have. Having a coordinated practice that will manage those administrative elements is invaluable for many practitioners. And we think it will be one of the ways that we can bring our graduates back to practice in Hawaii, because the barriers to establishing a practice will be greatly diminished.
I think the future of University Health Partners will be to continue to grow the practice so that we can represent a number of physician specialties, to continue to partner with our multiple teaching hospitals. We work very closely with Queens Medical Center, Hawaii Pacific Health, Kuakini Medical Center, and try to identify how we might successfully help them achieve their goals in terms of what the community needs in terms of healthcare, how things are changing in the healthcare environment, and how we maintain a stable infrastructure so the school can continue to develop and continue to train our students.